About a year ago, I founded Essential Health to address two problems in our society. The first problem is information overload that physicians face on a day-to-day basis. The second problem is the attack on the patient-physician relationship. Doctors are spending less and less time with their patient, and we'd like to turn that around. And the technology we're building to help solve that is based on a science fiction beat from the 1960s, the Star Trek's medical tricorder. And I'll talk about the sorts of technologies that go into building that. But first, I'd like to talk about some of the severe health problems we face as a society. Half of you in the audience, half the adults in America, have at least one, if not more, chronic diseases. That's hypertension, diabetes, asthma. And half of you don't get the health care you need to help you live a healthy life and to live longer. That means that by the time you're 65, 2 out of 3 people have 2 or more chronic diseases. 1 out of 7 have 6 or more chronic diseases. And because of the recent election, many people are going to lose their health insurance. So that's a real health care crisis we're facing. Now, interestingly, the Mayo Clinic published a study earlier this year showing that for every hour that a physician spends with the patient, that physician spends 2 hours doing mind-numbing clerical work with the computer system. That same study showed that 50% of physicians suffer something they call burnout. And what they mean by that is these physicians have lost the joy in their work. They're spending their time with computers rather than patients. And this can lead to errors in medical judgment. In fact, Dr. John Noseworthy, who's the CEO of Mayo Clinic, has said that 50% of physicians who are suffering from burnout may be at risk for medical errors. And errors in medical judgment can lead to death. In fact, earlier this year, the British Medical Journal published a study showing that medical errors are the 3rd leading cause of death in the United States. So we'd like to try to solve that problem. Now, I'll walk you through our journey from building a new device that moves from data to knowledge. This here is a picture of what traditionally medical records look like. For the past 10 years, we put that data into databases. A database is nothing more than a list of information, a list of patients, a list of diseases, a list of medications. But it doesn't tell the physician what meds were used with what disease. The next step of evolution in our information systems are things we call knowledge bases. A knowledge base contains a list of facts and the relationships between those facts. And in fact, the knowledge base can be used to deduce what information is missing from a database. So if the knowledge base has a relationship that insulin is used to treat diabetes, and the database says that the patient has insulin, but there is no recording of diabetes in the record, then the knowledge base can say, well, either the patient has diabetes or insulin is not appropriate medication. So that's one thing the knowledge base can do. The second thing a knowledge base can do is create something called an ontology. Ontology is like the Dewey Decimal System of medicine. It helps us to understand the level of granularity of diagnosis. In some billing systems, we only know that a patient has lung cancer. In a really good system, we'll know that they have non-small cell lung cancer. The next step of evolution is something called an expert system. An expert system does just that. It captures the knowledge of an expert, called heuristics. And a classic heuristic in an expert system would be, well, let's say that all women in their 40s should have at least 1 mammogram. And all women above the age of 50 should have a mammogram every other year. Now those are rules or heuristics that can be used to run against a database that says, well, if this woman hasn't had a mammogram, she should have one. The final piece of the puzzle is something we call a universal medical translator. Some of you may have seen or read a book called The Hitchhiker's Guide to the Galaxy, which had something called a babelfish you stick in your ear, and you can instantly understand any language in the universe. Well, that's what a universal medical language system can do. This here is an example of an instance of a babelfish system. If you look at it, we've got German measles at the bottom. That maps to something called a concept. Philosophers call that a type. And that can instantly map to any language representation of that concept, be it Japanese, Korean, Russian, Finnish. In fact, this technology was used by GE Healthcare at the Rio 2016 Olympics to help their Portuguese physicians understand records that were printed in English. So we've seen these things today. This here is our version of the medical tricorder. What you see here is information that is not in a database. It's information created by artificial intelligence that summarizes multiple data across multiple databases for a physician and tells the physician what sort of rules they need to follow to ensure that patient stays healthy. And by the way, they'll earn a lot more money from Medicare by doing so. Well, thank you for your time. I appreciate it.